I love to tell stories, and when I travel around the world and speak at conferences, every once in a while I get an opportunity to tell a story that actually means something. And for several years now, I have been telling one story more than any other story. And the very first time that I did this, it was at the International Association of Emergency Managers, which was quite humorous because what I did was I informed them it was this very big deal that I was speaking and I was their keynote, and I got up there and I sat down on a chair and I pulled out a children's book, and we had a cameraman that zoomed in on the book, and I told them that we were going to do story time. And sitting right in front of me was an admiral from the United States Navy, and there's about 6 guys from the Department of Justice sitting right there, and the looks on their faces were like, oh my God, he's kidding, right? And I was not. I read the entire book to them, and I turned the pages and I showed everybody the pictures, and it was like kindergarten. But it started a movement kind of that is still going to this day around the country, and so I'm going to challenge you guys with this story as well. So I'm going to start with this story because it applies very much to what I'm going to talk about. Many years ago, this book was written, I think almost 120 years ago, and I'm a collector of books, and I've told my kids this story 1,000 times. I can do a very short version of it. Once upon a time in a faraway land, there was a kingdom. And because there was a kingdom, there was a king. And kings tend to be haughty and egotistical, and this one was. He was very proud of his kingdom, but he was bored. And one day he heard about these 3 brothers who had special vision. And so curious, he called for the 3 brothers, and the 3 brothers stood before him, and he said, I hear that you have special vision. And sure enough, the first brother said, well, I have special vision. I have X-ray vision. I can see through buildings for up to a mile. The second brother said, well, I can see through buildings full of people, and I can see through steel. And the last brother said, I can see through anything. And the king said, I want you guys to be my guards. Surely I'll have a safe kingdom if the 3 of you are put in charge. And so they became his royal guards. Nothing ever bad happened in the kingdom, but after a while the king got bored again. He was very proud of these 3. Nothing ever got in or out of the kingdom without these 3 knowing. But one day, because the king was bored, he made an announcement to all the peasants. And he said that he was going to have a contest for 30 days. Over the course of 30 days, if anyone could get anything by, sneak anything by the guards, they would have a piece of his kingdom. So for 30 days, people from all over the country tried to sneak things past the guards. There's people dressed in costumes. There's people in hidden boxes. They tried to ship themselves in. But the guards saw through everything. But there was one thing that happened every day during that month that was kind of curious. There's a little boy by the name of Gillespie. On the very first day of that month, Gillespie came up to the gates of the city. And the guards stopped him. Gillespie was pulling a red wagon full of dirt. And the guards stopped him and said, what do you think you're trying to pull here? What do you have hidden in the dirt? And Gillespie said, well, you're the guards with the special vision. So they used their X-ray vision and they looked through the dirt and they saw nothing. So they let him pass, but they wrote it down in their logbook. 1 load of dirt. The next day, Gillespie came pulling a wagon full of hay, and the guards did the very same thing and the very same result. And the next day it was sticks, and the next day it was leaves, the next day it was trash, and this continued throughout the entire month while all the other peasants were also trying to sneak things past the guards. At the end of the month, on the 30th day, the king, proud of his guards more than ever before, called all of the peasants together, and he stood there and said, well, no one will have a piece of my kingdom ever because of these 3. And Gillespie said, but your majesty, I will have a piece of your kingdom because I did get past your guards. And so the king called the guards over and said, open your logbook. And they did, and they said, no. It was dirt, and there was leaves, and there was rocks, and there was gravel, and there was bricks, and there was trash. And they had it all right there in the logs. And the king said, you got nothing by me. And Gillespie said, your majesty, if you'll just follow me. And he began to skip away. So the king and the guards and all the peasants followed Gillespie all the way down the long street in front of the palace. down into a neighborhood, through the neighborhood, right to the other side of the city, where there was this huge building. When they arrived at the building, Gillespie turned around and said, "Your Majesty, I'm sorry, but you're about to lose your kingdom, because inside of that building was 30 red wagons." We talked yesterday about unprecedented. When you're making plans and you're looking at your departments, when you're looking at your job, when you're looking at how you do your job, it's not the big things that take us down usually. It's the thing we didn't think about. It's the thing we let get by us. When I first told the story to the International Association of Emergency Managers, I challenged them once a month to sit down and try to imagine what the red wagon would be that could take them all down. About 1 month later, I went and did a field exercise, massive, massive field exercise. It had taken 15 months to plan. It was supposed to take 9 hours. 5 minutes into it, I received a call on my radio to hurry to where the command center had been placed. I got there was a firefighter and a cop in a fist fight. There was no place to park all of the response vehicles, and they were fighting over parking. And we stopped an exercise that took 15 months to plan. A month later, they had a tornado, which is what the exercise was for. They had a tornado in real life that went through that town. And it went as smoothly as I've ever seen a disaster get responded to, because when they discovered that red wagon, the parking issue, they solved it immediately. So I want to challenge you to think about the red wagons, think about your department, think about your job, think about your position, and think about what it would take. What is the thing that could get by you that could take you all down? Mike and I have talked about this several times. Grego's been out with an injury. It happens. But what if he had gotten sick and then gotten all the other officers sick? And all of a sudden you've got 6 of them down with respiratory flu. That's quite the red wagon. Infectious disease control is quite serious, and oftentimes proves to be the red wagon that makes it so we can't do our job. Things like diseases, illnesses. So I take it very seriously, and I want you guys to start to look at things differently. That's all I want you to do, is just look at things different, kind of like a dog when he tips his head over because he's trying to understand English. That's all I want you to do today, is just kind of tip your head on its side. When we're all done, we're actually going to do a hands-on thing. That's why I've handed out the goggles. But another story for you. There was a gentleman by the name of Ron Murray back in 2014. You might remember this was in the news. Ron Murray was drinking a cup of coffee, had one of those little white lids on the top. He got all the way to the end of the coffee, and as he tipped his cup up like this, something hit the inside of that white cover. He took the white cover off, and sure enough, there was a dead mouse in the bottom of his cup. After it happened, I actually interviewed Ron Murray. It was quite funny. I asked him if he was ever going to drink coffee again. He said, "I'll never stop drinking coffee, but I am never going to drink it the same." Ever since I met Ron Murray, I will not, have never, used one of those little white lids on my coffee, ever. And when I go to a Starbucks, I will stick a straw in that thing, and I will swish it around to make sure there's nothing in the bottom. And oftentimes you will catch me taking 2 cups at a come and go, and just to double check that nothing came out of the little nozzle of the nasty little coffee thing. When you have a bad experience, you tend to do things differently. Ron Murray will never drink coffee the same again. I don't want you guys to do your job the same ever again after today. And I think I can actually accomplish that. I want to make you paranoid. I said this yesterday to somebody in this room. Paranoid people live longer. It's not necessarily a bad thing. Your entire job, your entire world in law enforcement is about one thing. In fact, every responder's world is really about one thing: contact. Now, you're not EMTs and you're not firefighters. There's a cop right there. Look at all of the people on this scene. There's a squad, there's a squad. Blood, and what else? Look at all the people walking through. Look at all of the contact in this picture. Or this one. 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 Contact. We are constantly coming in contact with unknowns. Every time we touch someone, every time we have contact, especially in this world, it's usually with somebody we don't know. Or we don't know where they've been. Or worse yet, we do know where they've been and wish we didn't have to have contact. So who should be paying attention to this? The people that are first in, the people that are the last in, the first out, the last out, us, all of us. In 1992, the Federal Occupational Health and Safety Administration said that we should require employers to create exposure plans for at-risk workers, that'd be us. Free Hep B vaccines, free post-exposure follow-up, and training on infectious disease risk and control. But you know what? It's really not much help, is it? Most of us know nothing about this. We've been told to do things a certain way. And we've always done them a certain way. And if we continue to do things a certain way, it could go horribly bad. When we began to talk about AIDS many years ago, all of a sudden that became a new issue, and it required notification of emergency responders if they were exposed to infectious disease, required employers to name a designated officer to communicate with a hospital in case there was an exposure. And then in 2019 it was extended. This is still in place today. I'll guarantee you, I probably go to most of your departments, this is not how we're doing it. I know of one department, of course, my local one, that's not how an exposure thing would be handled there. I know that. The Center for Disease Control says that infectious disease comes in two types. Number one, airborne. Number two, bloodborne. Think about your job. It's probably equal exposure to both for everybody in this room. The primary bloodborne are things like Hep B, Hep C, and HIV. Airborne would be like tuberculosis. Do we have to worry about tuberculosis anymore? I don't know. We just had 68 cases of TB come across the border in one group last week at El Paso. Walked across the border, sat down, and because of the catch and release, they sat down. They were there less than a half hour and they were released. When I was in Brownsville a month ago, we put 160 kids on an airplane. We had to carry 6 of them onto the airplane because they were so sick, because they were being transferred to the city of Chicago because there's no room down south for all these unaccompanied minors. Every kid on that plane was sick. Every one of them. We've got disease all over. Now we have a measles outbreak again. Which, by the way, if you're over 40, you're supposed to have your booster now. Your measles. So transmission of diseases, and I'm not going to bore you with a bunch of stuff, so you're going to see me skip slides today. But the transmission of diseases happens 2 ways. Direct contact, which you almost never have as a police officer. Spread by the direct contact with infected blood or bodily fluids from one person to another. Or indirect contact. An object, a doorknob, tissue, touching something they touched. Something that was in their pocket. Something that was in their backpack or in their car. Now, whether or not you get sick depends on a number of things. What type of organism it is. Some are very infectious, some not so much. Tuberculosis, very much so. The dose. How sick was the person that you touched? How infected were they? The strength of it. Different diseases have different strengths. The respiratory flu that's going around right now is incredibly strong. It's very easy to get and very easy to pass. And then there's that other thing where you're all stressed out all the time and your immune systems are down all the time and you're not getting enough sleep and you're freaking eating donuts because you're cops. Organisms like HIV and TB, they die very quickly when exposed to light and air. The Hep B virus, however, can survive up to 7 days in dried blood. I want you to think about something. I don't know all of you, and I don't know how you do things, but how many of you wear the shoes that you wear when you're at work home? Well, you're not around anybody that ever gets sick. You shouldn't have to worry about this at all. The body's natural defenses, first of all, are the skin. Second of all, cilia. It's the reason why we all have hair in our nose. Then we have our GI tract, which is supposed to take care of things. The older we get, the worse that gets. And then obviously our immune system. Here's the risk for you. The risk is higher if you get stuck by a needle. Whether you're around stormwater, floodwater that's contaminated, or sewage. Contact with other victims that have come in contact with these things. Debris transfer, and even dirt. Hep B, we know about these things, but I want to refresh your memory a little bit about how dangerous some of these things can be. First of all, the Hep B virus, it'd be 6 months before you even knew, and it starts out like the flu. Ends up with liver infection. There are medications, but they're not effective to everybody. So the prevention is really the only way to beat the Hep B. Hep C also causes liver disease. Bloodborne causes fatigue, abdominal pain, nausea, loss of appetite. Again, you don't even usually know you've got it until you turn all yellow. Tuberculosis, spread by droplets in the air. They just did a recent study on a sneeze. How far a sneeze goes. We've all seen those pictures. I'm going to show one later. How far can a sneeze go, you think? How far? 10 feet, he says. Anybody else got a guess? MIT just did the study. It was 2 months ago. Anybody else got a guess? He says 10 feet. How big's the inside of a squad car, you think? Is it 10 feet? Anybody ever sneeze in the back of your car? The droplets from a good sneeze will go 200 feet. 200 feet, they'll stay airborne. Most people infected with TB have no symptoms at all. You'll never even know. See, I told you I'd skip. By the way, TB is the #1 concern right now for CDC. HIV. The transmission of HIV, sexual contact, male to male, male to female. There's very few cases of female to male. Sharing IV drugs and needles and syringes, at least we don't ever deal with people that do that. Then there's breast milk, and then of course blood transfusions. I told you I was going to keep you. I want to get to something more fun. We have antibiotic-resistant infections now that are on the market, that are out there. CDC is having trouble actually defining all of them, but these are things like MRSA. So the minute you're a school officer, this is where we start worrying about MRSA. I was actually out with a law enforcement officer about 3 months ago where they pulled the guy out of the house, they set him down in front of the house, and he was bleeding from the leg, and they couldn't figure out why. And one of the officers had blood all over them, and they said, is that a fresh injury? And he said, no, I have MRSA. There was 6 cops that had dragged him out. And it was huge. I mean, it was just eating his leg. C-DIFF is another one. I just recently dealt a couple of weeks ago with several officers that had C-DIFF, that they'd actually gotten from being out on a call. All of us are pre-hospital workers, and so dangerous to anybody that's pre-hospital, like at a car accident, things like that. Victim patient does not mention that they have an infection. They don't tell you. Why would they tell you? They're already mad at you because you're there. They're not going to, that's not the first thing they say as you're dragging them out. Responders only find out after reading paperwork or if the ER contacts them later. And the fact that MRSA already exists within all of us, all we have to do is come in contact with somebody, and it happens very quickly. Measles, if you want to look at all the measles with the respiratory flu and everything else that's going around, fever, dry cough, runny nose, sore throat, inflamed eyes, if you stop right there, almost everybody has had this over the course of the last couple months. Not a big deal, we get the flu, those are the symptoms. Here's the problem with the measles. The measles now, all of a sudden, it develops so fast, especially in older adults, and the contagious nature of measles is why it's spreading so fast. And we're in the middle of a measles outbreak right now. The people in your community that have measles are not wearing shirts that say, hey, I have measles. But watch how fast this moves. This is from one person. That's 3 days. That's 3 days of how fast the measles can spread. Of course, we had that Ebola outbreak and nobody paid any attention to that. We now have a larger Ebola outbreak than the last one that is occurring right now, and no one's paying any attention to that at all. However, all you need to do is come in contact with somebody that's been traveling recently, and it would start. This is what we're told will protect us. How much of this do we wear on the job? Perhaps the glasses, sometimes the gloves, right? But anybody else, if we were to pick up somebody that was infected and put them into a squad car right now and take them to the hospital, and the hospital was to say they're infected with something, all of this is what they would have on, but you don't. And I remember the day that we began to look through the squad car and we were trying to find rubber gloves. It was like, oh, we ran out. Nobody told me we ran out. This is from about a month ago from EMS1. Stopping the spread of disease starts with protecting yourself from infection. First responders may encounter countless diseases, including influenza, MRSA, VRSA, TB, C-DIFF, HIV, and more. When responding to any situation, responders must ensure they are properly protected. They must always wear personal protective equipment when treating all patients or dealing with them. You're pre-hospital. In many cases, wearing patient care gloves, safety glasses, and an N95 type mask that can help prevent infection. And now look at how we have to do our jobs. We can't do that. It would stop us from doing our job. I don't see any of you going out there wearing an N95 mask. But the problem is, we're in the same world that everybody else is that's wearing them. Here's the rule for infectious control. If it's wet and it's not yours, don't touch it. That's the rule. Go talk to anybody in EMS, they'll tell you that's the rule. Go talk to anybody in fire, they'll tell you that's the rule. You go to a hospital, they know that's the rule. That's why there's PPE. You go to law enforcement and we don't have that option. You do not have that option. So there's got to be something else that we can do. Here's part of it. Part of it starts with just even cleaning our equipment. And this is where we're going to start to have fun. When you start cleaning things on a regular basis the way they're supposed to, you can prevent most of the infections that you are now susceptible to. Clean every squad interior after a call. Does anybody do that? How often is a squad car, and I don't care who it is, Jamal, how often is a squad car cleaned where you work? Once every 3 months. And how many people do you think are in that car, in the back seat, in that 3 months? Okay, 10 how often? 10 over 3 months? Like in 3 months, how many people have you arrested and put in a car?
About 10.
Okay. Tiny town, right? Do you know those people?
No.
Were they sick? Any of them drunk?
Not yet.
Not yet. Clean everything that you use Be sure you, your uniform, and your gear are always washed. Wash your hands after every call. We don't even do that. I don't think we even do that. Most people don't even know how to wash their hands properly. But guys are worse. Guys are worse because truck stops are fun and I travel a lot. So I have one lady in the room and she's going to appreciate this. Let me tell you how we wash our hands. We wash our hands if we both step away from the urinal at the same time. Because you don't want to be the guy. See? You don't want to be the guy that didn't wash his hands, because if you bump into him when you're over by the coffee machine in the truck stop, he's like, oh, gross, man. He's a dude that didn't wash his hands. So the only reason why we really wash our hands is because someone else is in the bathroom. That's how we do it. If no one else is in the bathroom, we're like, screw it, we'll wash them later. What am I lying? It takes up too much time. I had a theory once that if I just put hand sanitizer in my junk first thing in the morning, I don't know if that's medically sound, but doesn't that kind of make sense? I don't think I'd try that, man. That's like 90% alcohol. The law says that we must have an infectious disease control policy. If I questioned everybody in this room, could you answer questions about your policy? When was the last time you looked at it? It's quiet in here. The law says that we must include contact information for an infection control officer. Who's yours, Mike? Right? The policy must be presented to all personnel, and they have to be trained on it annually. Annually would be better. If you could really be anal about it and train them, that'd be even better, but we're not even doing it annually. I know, this is fun, right? It's going to get really gross, too, in a minute. Every policy, this is the law. You guys are in law. This is the law. Departmental Education and Training for Bloodborne Pathogens. A review of workplace-specific infection control procedures, post-exposure policy, and follow-up testing and documentation. We're all doing it, right? Check, check, check. Is cleaning part of your policy? Of course it is. Every 3 months, no matter who's in there, we're going to get right to it. Oh my God. Oh my God. Yet we're bringing some of these people to the hospital that has a completely different policy. Us, it's okay. Follow the footprints. Who's got kids in the room? Okay. How old?
18 and 14.
18 and 14. You wear the same clothes that you wear at work all the way home. All those pictures of contact. Think about what's in your house now. Same shoes. I can prove to you, and I'm going to, that we leave our work at our house. We bring it home and we leave it there for our kids. My kid, while I was here, my newest kid just started to crawl yesterday. So I got the video from mom yesterday. And she left him on the changing pad. She walked out into the kitchen, walked back out into the living room, and he was gone. So he started crawling yesterday. Started crawling across the carpet that I walked on after I'm in my world. Follow the footprints. The mistakes that we make and the laziness that we allow can impact the permanent health of not only us, but our families. Chris was up here yesterday and was talking about forensic lights. I'm not a forensic expert. But I told you that I get these ideas stuck in my head. And when I first met the guys from Chris's company, I didn't even know they had forensic lights. When I found out they had forensic lights, it was about the same time that that company was supplying lights to the TV show CSI, which at that time was my favorite show. I knew that those blue lights made stuff glow. So I went to the company, I was like, you gotta give me one of those lights. So they did. They gave me one. It was a little one. It wasn't this big one. But they gave me one. And it had this cool blue light. And you know what I did with it, right? Oh, I took it to a hotel. First hotel I stayed at. Never forget. Stood there and went, holy cow, that's a lot. And then I went, and my assistant was with me. I swear to God, you guys, I'm never going to forget this. I went like this, and I looked at the headboard, and I went, and I seriously did this. I went,